Hi, my name is Dr. Crystal Aguh, board-certified dermatologist and hair loss expert, here to talk to you today about why you should incorporate Minoxidil, better known as Rogaine, into your hair care routine. So, one thing that I think many people don't realize is that as we get older, our hair naturally thins out. And so even if we're not losing hair, as we age, each hair that grows from our scalp grows in a little bit thinner and covers less scalp. And for that reason, for many women, it's easier to see parts of our scalp, particularly the front of our scalp, like our hairline here or our middle part, becomes a lot more visible than it was when you're younger. And so that can be very, very distressing to many women. It can make it difficult to style your hair. You may find yourself using camouflage, like a little bit of eyeshadow or hair filler fibers, to help fill in the appearance of your hairline. And I really would encourage you to use Minoxidil if that's the case. Minoxidil actually works by increasing blood flow to your hair follicles, thereby stimulating hair growth. And so what it tells the scalp to do is it actually tells the scalp to thicken up each hair strand. And so by doing so, it's able to help cover some of these areas where the scalp is visible. Over-the-counter Minoxidil is typically available in a solution or a foam. If you have straight hair, I would recommend using the foam because it is less likely to irritate the scalp, and it's very easy to wash out if you're washing your hair every day or every other day. On the contrary, if you have curly hair, I would not recommend the foam because that can build up if you're not washing your hair frequently. Instead, I'd recommend the solution because that evaporates very easily into thin air. The downside of the solution is that it can dry out the scalp and cause flaking and a little bit of itching. And so I recommend that if you do use the solution, apply a light leave-in oil or moisturizer every time you use Rogaine to minimize the chances of dryness. Now, the big question I get from everybody is, do I have to use Rogaine forever? And the answer is yes, you do. And that is because the scalp is just like skin. So if you think about any skin preparation, whether it's an anti-wrinkle cream, it's a cream used to even out your skin tone, if you just use that for a week or a month and you stop, you will notice that within a few months, all of that benefit that you gained kind of goes away. And that's because the skin cells turn over every 2 weeks. And it really requires constant, consistent use to sustain any benefits. And the scalp is the same way. Those scalp skin cells, they turn over every 2 weeks as well. And so while Minoxidil may be able to tell your scalp today to grow in thick hairs, if you stop using it, that message will be lost to the scalp and hair that's growing 1, 2, 3, 5 years from now. And so I do recommend incorporating it into your beauty routine like you do any moisturizer or any toner or any serum that you love for your face. I recommend incorporating Minoxidil for your hair. If you have severe thinning, then you can see a board-certified dermatologist who can prescribe a higher strength Minoxidil that may be more effective for you. If you have any other questions on skin, hair, or any other health tips, feel free to visit FemHealth. We have so many tips and experts available for you. Bye.